If your sweet loving dog just beat someone out of the blue, stop. Before you call a trainer, you need to hear this. I'm Dr. Orion, a veterinarian and a veterinary behavior specialist. And I'm going to show you how aggression is not always behavioral. It might actually be subtle signs of a medical issue, even an urgent one. Yes, aggression in most cases is due to fear, stress, anxiety, or other interactions between your dog and the environment, meaning other people, other dogs, other animals in general, or even things in the environment that are inanimate, like sounds or different items. But what I usually tell my patients, well, actually I tell it to my clients because my patients don't speak English, is that if their pet changed behavior all of a sudden, it's medical until proven otherwise. The only caveat is if it happens right after a specific incident that the owners can actually point. For example, there was a very loud explosion, or your dog got into a dog fight, and that was the trigger for this fast progression of the unwanted behavior. But a caveat for the caveat is that sometimes owners don't really know what happened because they were just not around the dog when it did happen. But as I said, medical until proven otherwise. So what can it be? Basically anything that causes pain or discomfort can lead to your dog's behavior changing really rapidly, really fast. And let me give you a few examples. For some reason, for most people, the most obvious one would be something neurological. Something in the brain itself that's causing your dog's behavior to change, and that can be either something physical like a tumor or some trauma to the head, but it can actually be other systems in the dog's body that are affecting the brain. For example, if the liver is shutting down, then there might not be a right amount of filtering of the blood, leading to more toxic products inside of the blood that can actually affect the dog's behavior, because it goes from the blood to the brain. But although possible, I have to say that in most cases, it's not neurological, it's probably more likely to do with something that's causing pain or discomfort. Now, sometimes it might actually be a chronic condition that just got to a point where it's bothering your dog so much that he can't hide it anymore. For example, dental issues. Yes, dental issues can actually lead to your dog becoming aggressive, or osteoarthritis. You will be surprised how many times osteoarthritis is not considered as the cause for your dog's behavior change. All it takes is for a dog with a chronic condition like osteoarthritis to have this flare-up. Maybe the dog slipped or something when you weren't watching, but maybe nothing actually happened to lead to this flare-up, but it still happened because that's the natural progression of many of the chronic diseases, and all of a sudden the dog is in pain, leading him to be very aloof, and basically like me when I'm having a migraine headache is not wanting to interact with anyone. If I have a headache, the last thing I want to do is to interact, like just leave me alone. Now, unlike Breadstick over here, when I'm in pain, I can just say, I'm in pain. But when he is in pain, or when your pet is in pain, they can't just tell you that they're in pain. So they basically try to avoid the interaction that they believe might cause pain. And how do they do that? Well, with their mouth. But sometimes that means biting, growling, air snapping, or any other aggressive behavior. Kind of like the best defense is offense. So here are a few things that you might need to look for in your dog that might indicate that you should probably consider an underlying medical condition causing the behavior change. If we're talking about neurological conditions, many times you will see other things that affect different neurons in the body or different systems in the brain, leading to behaviors like circling, the pet will start circling usually to only one specific direction, so counterclockwise or clockwise. They might be head pressing, basically putting their heads, their foreheads on the wall and pressing. They might be aimlessly walking around the house and you might not even be able to stop them from doing it. They might be air snapping, like there's some sort of invisible flies in the air. They might have a weird sound coming out of them, like weird vocalization. And of course, they might actually have a full-blown malground seizure, meaning that they might actually fall down to the ground, pedal with their legs. They will not respond to you even if you try to get their attention. And in many cases, they will have what's called the post-ictal phase, where they're not completely back to their normal selves. They kind of look weird. As far as pain or discomfort goes, well, again, aggression for both of these things is a big one, but trying to avoid being touched on a specific area or a specific location on the body is a big one. Not wanting to play anymore or not wanting to go on a walk like they did before. Dental pain might, of course, be associated with eating less or dropping food out of their mouth. And by the way, eating less can also be a result of other medical conditions. So this one is actually a big one. Hiding and not being able to lay down is a big one. So what should you do if your dog has a sudden behavioral change, or if you're suspecting that your dog might be sick? Well, as I said, because we think it's medical until proven otherwise, the first thing you want to do is go to a veterinarian. The veterinarian will take the history from you, asking you a lot of questions about when the behavior started or what kind of changes you can see. And then they'll do a physical exam. They will try to see if they can feel something abnormal, like a mass somewhere, or maybe signs of pain. And even just by observing your pet, they might give some sort of a score, like PAR, bright, alert, and responsive, or QAR, quiet, alert, and responsive, and so on. And then there's a good chance they will want to do some blood work and probably a urinalysis. That helps rule out a lot of conditions. If they're suspecting some sort of pain, they might even recommend doing x-rays or an abdominal ultrasound. And technically, they will go from there. If they find more issues, they will probably want you to do a more specialized diagnostics, but there's also another option that they might recommend, and that to actually start some sort of a treatment. For example, if you're suspecting pain, we'll probably start the dog on some pain medications. Only if you ruled out those conditions, the medical conditions, then we will start thinking about behavioral causes, and then, well, that's when you go to see me, a veterinary behaviorist. I know it was a lot, but I hope that helped. Please write down in the comments if there's a topic that interests you, and I will try and do a video about that. In the meantime, why not watch this video next? Say bye, Brady! Bye!